Ladies and gentlemen, dear colleagues, I will proceed in English. It's not too easy to talk medicine in Hungarian, but I'm improving every day. Anyway, after these two lectures, I think it's not easy to talk about the same subject, but anyway, I think that the surgical oncologist point of view will be a little bit different than this way. As I'm also a teaching professor at the medical faculty, I always like to define what's the problem. So the primary prevention should minimize the impact of risk factor, which leads the onset of the disease, and prevent the disease actually before it happens. And it includes promotion, preservation of health, suppression, and prevention of the disease. The secondary, we already heard that is actively looking for the already gotten sick and seemingly healthy population. They are asymptomatic disease before it becomes symptomatic. And what can we do about all those things? I won't go deep into the primary prevention. I just make the HPV like a most important risk factor for not only the cervical cancer, as it was said before, a numerous other cancer like anorectal, oropharyngeal, vaginal, penises, and also. Anyway, the natural flow of HPV infection and the biological behavior of premalignant lesions allow us the prevention of cervical cancer to be achieved at every level. And we in Serbia have 3 levels of medical services at primary, secondary, and tertiary. Anyway, the vaccination is very well known, and the vaccine is old enough for everyone, especially the younger one, to get it. And in Serbia, from June 22, the vaccination with the 9-valent HPV vaccine intended for children aged 9 to 19 is available in all primary healthcare centers in Serbia, fully covered by Health Insurance Fund. And we have 2 doses for those between 9 and 40 and 3 doses after 15 years of age, because I was told that the immune system is not so good after 15 years of age, and I was a little bit surprised, but someone could that explain to the surgeon. Anyway, as you said, the vaccination coverage in Serbia is still very low. It's only 6.2% at the moment, according to the data in May this year. And I find a very nice data that compare the presence of HPV in USA, Serbia, and Hungary. It's maybe not up to date, but it's 3-4 years maybe before. And you can see what's the difference between the oropharyngeal, the cervical, the anal cancer, and the presence of the HPV virus in those cancers. As eliminating or reducing the risk for colorectal cancer and the primary prevention, we can, as we talk about inadequate nutrition, overweight, low physical activity, excessive alcohol consumption, etc. For breast cancer, those prevention is very limited, and it's more directed to early detection. And we have a lot of educational and health promotion activities, as you said, and try to make different lifestyles, to promote different lifestyles, healthy environment, and so on. And among those healthy activities, as you said, it started only a few days before. It's in Temerin, that's in province of Vojvodina, on the northern part of Serbia, like less than 100 kilometers to the Hungarian border. And we try to make these promotion activities in villages where there is only primary care level services, meaning that there is no dermatologist. So we send the dermatologist, and only in 2 days, as you said, 7th and 8th of June in Temerin, there were 362 dermoscopic evaluation, 11 new melanoma. It's almost every 5th. It's unbelievable how many cases we find it, and 62 suspicious lesion. And maybe it's good to say that the use of tanning beds was banned in Serbia back in 2009 for people who are aged up to 18 years of old. If we talk about the organized screening for those 3 oncological site, cervical collector, and breast cancer. It started in 2012. The goal of breast cancer screening is, as we said, it's reduce mortality, while the organized screening of cervical and colorectal cancer is reducing both incidence and mortality too. The screening test, as we know, must be highly sensitive, specific, and easy to apply, and we have those tests in every course site. As concerning the cervical cancer screening, as we know, the most HPV infection clear up in 4 months up to 2 years. There are no symptoms at all, so the people are unaware that they are infected and can spread the viruses. But small proportion of these infections become chronic, and precancerous lesion progress to invasive cancer, and it can happen in 10 to 15 years or 20 years. But in case of compromised immunity, it can take as short as 5 years. We have about 1,100 new cervical cancer cases annually and 550 deaths. It ranks as the 4th leading cause of female cancer in Serbia, and is the 2nd most common female cancer, and also the 2nd leading cause of cancer deaths in women aged 15 to 45 years old. The crude incidence is very high. We have the vaccination, like a primary prevention, but screening, secondary prevention, all allow precancerous lesions to be identified when they can be easily treated. And early treatment prevents up to 80% of cervical cancer. The selection of the screening test depends on existing resources rather than the differences in efficacy. The screening program in Serbia is like you see on the slide. So the target population is between 25 and 60 years of age. The test is cervical smear, as almost everyone. We are also talking about the HPV tests over 30 years of her, but it's only the pilot in Belgrade, and we hope that it will spread throughout the country. And the global strategy we had already seen, so I will skip this slide. And the idea is to eliminate cervical cancer, and Australia is probably like the first country to introduce the HPV vaccine, can do that up to 2035. Concerning the colorectal cancer, the screening is the only way for early detection. There are no precise early symptoms. It's a curable disease with 5-year survival, more than 90% if the tumor is localized, 80% of regional, and less than 10% when it's the metastatic disease. There are around 4,500 new cases yearly in Serbia, and around 3,000 deaths from colorectal cancer. The colorectal screening is the annual fecal occult blood test. We have 2 types, the GFOBT and the fecal immunochemical test. If abnormal, of course, we'll need colonoscopy. The compliance is really limited. It's up to 70%. And we saw that mortality from colorectal cancer can decrease by 33% if annual FOB group was introduced according to the control group after 13 years of follow-up. But we have several problems: lack of tests, trained colonoscopists, high the price, and low compliance, which are the drawback of the screening. The golden standard would be the colonoscopy. Otherwise, it's the final pathway of the screening programs, allows complete examination of the colon, biopsy, and resection of the polyps, as it was said, and in that way it could be a primary prevention of colorectal cancer. There's a lot of talk in Serbia about the virtual colonoscopy, because they said no pain, no prep, no risk. It's not true. Full preparation is needed, similar to the colonoscopy, and the perforation risk you can see, it's not so different, but the compliance in Serbia is pretty higher than to the plain colonoscopy. The main characteristic is probably the same as in other countries. So it's men and women between 50 and 70 years of age. It should include at least 75% of the population. The screening cycle is 2 years with IFOP test, and of course it's the positive IFOP test, then it's go to the colonoscopy. Concerning the breast cancer screening, we already heard that there are countries that offer organized screening programs very vary. There is a variety of participation rates also, and the 70% would be like, but there is some concern about the benefits and the harms of screening for breast cancer. Benefits, of course, are the reduction in mortality, the reduced suffering for metastatic disease, the breast conserving surgery, feeling of security. On the other hand, the false positive, the overdiagnosis, the anxiety, and false negative, a sense of security is the drawbacks of the screening. The typical mammography screening program is two-view mammography targeting the women between 50 and 69 of age, biannually with double reading. There are some expectation, like in Sweden, in Iceland, in UK, it's a 3-year interval. But anyway, the high-risk screening could combine annual mammography with regular mammography, and the risk of being diagnosed with breast cancer stage 2 or higher is 70%. The next generation screening modality is breast tomosynthesis. As we can see, 30% more cancers in screening can be detected in that way. And as I heard that you also in Hungary wants to use tomosynthesis in the screening program for breast cancer. Anyway, the Serbian breast cancer program, the target population are at the moment 50 to 69 years. We also want to broaden that from 45 to 74. The aim to include at least 75% of the population, the 2-year cycle, double performed reading with 2 independent trained radiologists for screening mammography. We have the mobile program, and only in this year we already screened more than 15,000 women, and 37 breast cancer are detected. As we have to improve with this program, artificial intelligence will be introduced in Serbia, and in 2 different ways. One of that is to exclude the BIRATS-1 and BIRATS-2 findings, and that's almost 80% of cases, and to introduce the double reading with 1 radiologist and artificial intelligence. And by the end of the year, it will start, hopefully. We'll see what will happen. We have some results and challenges of lung cancer screening in Serbia. The pilot lung cancer screening in Serbia started in October 2020. Between persons aged 50 to 70 with a heavy smoking history and additional risk factors, they undergo LDCT evaluation. It's more than almost 3,500 scans were performed, and you can say that the detection rate was 1.8%, and 70% were diagnosed on the baseline screening. It's very good, but it's only regional at the moment, and it's going on in Vojvodina, like the region that covers around 2 million people. I don't know if I said Serbia is 6.5 million people. We have 24,000 new cancer cases per year and 17,000 deaths yearly from cancer. That would be all, but I want to ask you to the 4th Serbian Senology Congress that will be held in September 27 and 28. As far as I know, Dr. Matra Zoltan will also be there. I see that he has some lectures there. And of course, I like to want you to pay attention for the Expo 2027 that will be placed in Belgrade in several years. So you are very welcome to do that and come and visit us for that too. Thank you very much.